can, okay.
Just tell me where to stand.
I mean, if he's up here talking and I'm over here, then I can record and I can still watch
Strip people and yeah.
Yep.
All right, so today's lecture is supposed to be on pulmonary rehab. And then, so I'm going to talk about pulmonary rehab, kind of go through, see if you have any questions. Probably here about 20 minutes until Jen Goodhart, probably a lot of you know her, one of our nurses. She's going to come in and she's going to talk kind of the after rehab, like what you can do afterwards. And just some options. We used to have a kind of a phase 3 here in the clinic where you come and exercise. We don't have that at the moment, but we don't have that, but there are some other options. So I'm going to go through that. She's well versed in that area.
So you don't call the cardiopulmonary rehab part of building your lungs back?
The cardiopulmonary, what about it?
You don't consider that helpful towards our lungs?
Oh, cardio, the heart and the lungs work together.
Yes, yeah.
So yeah, it's all, you need, I have one to help with the other. So they work together. So that's why we call it cardiopulmonary. We have cardiac and we have the pulmonary side as well. So, so kind of the first thing I just want to kind of like walk through, let's say that, I'm going to just pick on Bruce here. Let's say Bruce goes and wants to learn about pulmonary rehab, wants to go and maybe find out how I can do it. He can go and see his physician. It can be your primary, it can be your pulmonologist, and you just talk to them about getting into the program. You'll need a referral to get into the program. And so there's certain things that go in kind of qualifiers for the referral, and most of the doctors are pretty well versed with that, where they can find out. But you as a patient, just pretty much I would go to have that discussion with your physician about it. So there are certain things as far as COPD, pulmonary fibrosis. Yes.
I'm sorry to interrupt you. I just want to clarify that we're talking two separate things, not apples and apples that you're using different terminology. When you say pulmonary rehab, you're not referring to the cardiopulmonary 12-week session.
Yes, I am.
Okay,
yes.
So you're calling it a rehab.
Yes, and the referral would be the same as if you were going on the cardiac side too.
Okay.
I'm just kind of focusing a little bit more on we're going to talk a little bit more on pulmonary. I can certainly talk about some of the similarities and differences.
No, I never heard them speak of it as rehab, so I wanted to make sure we're. Okay.
Yes, that's a 12-week program. Got it. And so you can go to see a doctor. There's a list of diagnoses that if you have that, they can get you into the program. Generally, if you're a COPD, there's some limitations on how many sessions you can have. Generally, it's like 72 lifetime sessions with the COPD diagnosis. But there are other diagnoses as well that can work for it. So sometimes people will come and not only once, sometimes they'll come back to the program. So that would be the first step, is talking to your provider about it and getting a referral. Once you get a referral, then you can call pulmonary rehab and call the receptionist up here, and they can get you scheduled for an intake appointment. And so an intake appointment is just basically you come in for about an hour. The nurse is going to ask you some questions. You're going to fill out some surveys. And then we're going to do some exercise testing with you. And then after that, then we'll go ahead and we'll get stuff set up for you. And then they'll talk to you about classes, options. We have, on the pulmonary side, we have Tuesday, Thursday classes. We have Monday, Wednesday, Friday classes. Also, there are some people that maybe they want the Monday, Wednesday classes, but they can't do the Friday. So even though it's 3 days a week, you can also do 2 days. Generally, you get approved for 36 sessions. But if you are planning on coming 2 days a week, it's a 12-week program. So you'd be basically we have you down for 24 sessions. Where if you come 3 days a week, then you can get the full 36 sessions. So, but the referral is generally good for 36 sessions. And so then they were talking about class options. There's also other stuff too they were talking about on the pillars here. Other classes as far as dietitian, social work, physical therapy, respiratory therapy, consults you can do. And so they'll get all that information set up with you on your intake tape. And then you'll have a start date. And it doesn't have to be immediately that week. It could be out a week or two. But we generally want to keep you within a month. We want to have you in the gym working out. If it's longer than a month, then what we need to do is we need to do a new intake. And that happens on occasion. Maybe someone gets sick, and so they're sick for a month, or they end up having emergency surgery. What that happens, then we would just have to redo the intake appointment. That's more than 30 days. And the reason why is because we set up an exercise prescription with you, so we want to make sure that it's appropriate. And so if a month's gone by and you haven't exercised, then we need to get you to see where you're at as far as exercise.
Does that start the 36 sessions over? Or just what's left over?
It would be what's left over, but if you haven't had any classes, then that's not going to count against you on that. So it's only if you've had some. Like sometimes if you go for 6 sessions and then you have to discharge, well, you can come back and finish up to 30 sessions. And anything above that would require a new referral. And any questions so far? Yes.
So if when you go to the doctor and they ask you, and you ask them for a referral, what are you exactly asking? A pulmonary referral or?
You would go, if you're a cardiologist, they're probably going to be working with you with some cardiac issues. I'll probably be referring you to cardiac.
This is a COPD issue.
Yeah, so it would probably be pulmonary rehab. And so you would just go to the doctor and say, I'd like to go to pulmonary rehab, and then they would be able to give you that referral.
Okay, thank you.
You're welcome.
You should check on Terry's discharge paperwork, but because I think we did put in a referral.
Okay,
And then the phone number will be there too.
okay.
Yeah, so getting the referral, that's a big thing. We want to make sure that your insurance is going to pay for it and everything's authorized.
Okay.
And they're really good here. We have people that are up at the front desk that are well versed.
Yeah, right here.
Yeah, and then the people at the front desk are well versed with that kind of know the ins and outs of the information with that. Because you just don't want to be charged for a session when your insurance can be paid for. So.
All right.
And so that's the hard part, is really getting that. And then we get started with rehab on day 1. And then you're going to come to class. It's going to be foreign to you. Some may not exercise at all. Some may exercise some may exercise a little bit more. And so some of this can be a big change for people. And so kind of what happens when you come to class, we're gonna we start you off. On day 1, you come in, you check at the front desk. We get your weight, we get you checking with your blood pressure and so forth. And then we get you going. We get you going day 1 with exercise. So we'll have you on a couple modalities. And one thing I want to backtrack to is when we do the exercise testing on the intake, we do for the pulmonary patients, we do a 6-minute walk test assessment. So we have you walk around the track for 6 minutes, and then we just we get what we call a MET level. It's a measure of exercise capacity. So we get a MET level to start off with. And so that's what we're going to kind of generate. We're going to look at that MET level when we're looking at exercise modalities and getting you started. And so that MET level is something that we're going to be watching. Like during the program, we're going to, as case managers, we have a goal MET level. So I'm just going to use an example. Let's say that on the walk assessment, you got a 2.5 MET level. We may put down, we want a goal of 5. We want to double that. And so during the program, we're going to be trying to work up to that. And we can do that with different modalities by increasing and so forth. So you're going to see some increases as we go along as you're able to do. And I find most people get pretty close to that goal MET level and even surpass it as well. But there's a lot, yes.
We use
oxygen when you're doing these walking tests? Can the patient use oxygen?
If you are on oxygen at home, yes, then we will. We're not just gonna put you on oxygen unless you're like what you're prescribed.
Right.
But there's times in the program that we can also do oxygen assessments with you as well. And especially if it looks like you may need oxygen with exercise. But on day one, we're only gonna put you on what you wear at home, what you're prescribed. The test. Because sometimes we do the test and people may drop to 86%. Yeah, but we start you off oxygen, we're gonna leave you off oxygen for the duration of the test. And then we'll kind of we'll look in the future at maybe like if we need to get you oxygen or if we need to increase your oxygen and so forth.
86 would be good for me.
So yeah, we keep it pretty consistent on the walk test. We don't add oxygen, I guess is what I'm saying, because it kind of tweaks the numbers a little bit. Because if I gave you 40 liters of oxygen, you probably make it a little further than what you did before. So keep it the same. And so then we have the exercises. So we're gonna come up with a general exercise prescription for you. We're gonna have you on 2 modalities. And the American Heart Association recommends about 150 minutes a week of exercise. And this is for everybody, all ages. And they say that most of that's going to be moderate intensity. And as for some, they want you to about 70 minutes up. They want it to be a higher intensity. But 150 minutes. So just kind of throw that out there. So if you're at rehab, we have you 3 days a week, 30 minutes of exercise times 3, that's 90. So that means we need to do 60 minutes at home to meet that goal. We can certainly do more than that. But so when you come in, there are going to be 2 modalities. We do a 5-minute warm up every day. That doesn't count as exercise. That's going to be a lighter as far as intensity. Like if we get you on the treadmill, we'll have you warm up for about 5 minutes, and then we go into and we'll have you on 2 modalities. We'll do for 30 minutes total of exercise. So, and then after that, what happens is you come back. We're going to do group bands exercises. There's stretchy bands. We do band strength exercises for 10 minutes. On the cardiac side, they do flip from individual weights. Not individual weights, sorry, hand weights. And certainly the dumbbells, some of the ones on the pulmonary side do that, but 10 minutes of weight training, and we call that either bands or dumbbells. And then we do 10 minutes of education. And then we get you out of here. So it's basically, once you come in, once you get started, it's an hour every day. So something to think about, that you want to be able to commit yourself to this. And so kind of look at your schedule, make sure that that's something that's doable for 12 weeks, because it's not easy. So it's not boot camp, but it's definitely a challenge. So certainly look at that, and so an hour of exercise in the gym, and then those modalities, there's a lot. We have new steps. So a lot of it, some of it we'll be looking at how well do you do. We like to have you, optimally, we like to have you on a 1 standing, 1 sitting modality, if able to. When I say modality, that means treadmill. That means walking. That means new step. That means aerodyne. There's become a stepper. There's different ones that we can do. If you're not able to do standing, knee issues, that kind of stuff, we can also have you sitting modalities as well. But optimally, we like to have one standing and 1 sitting. So, any questions so far? Okay. So when we're in the gym, I want to kind of talk about the pillars of lifestyle medicine here. And there's six pillars up here, and there's also a 7th one I'll add and I'll talk about as well. But kind of have up here, I'm going to put this for the camera. So we have healthy eating is 1, physical activity, increased physical activity, manage stress, substance, sleep, relationships, and oxygen titration. Would be a 7th one that's not on here, but very important, especially on the pulmonary side. And so there are a lot of, when we talk about these, we talk like the dietitian. when you're in the program, there's a cost. And the classes, as far as the extra stuff you do, social work, dietitian, respiratory therapy, and so forth, that's all included in the cost. So it's not like when you go out and they bill you separately when you go see the physical therapist, they bill you $80 or something like that. It's all included into the cost of the program. That's why I recommend to people, you know, at least if you haven't seen the dietitian, see the social work. When I first came, lifestyle medicine, and, you know, I worked a lot of years over in the hospital. My view of social work was like this. This is social work right here, and this is dropping this. And since being over here, I realized what social work does. There's a lot of different options. So I certainly, the first question I'd be, when I came in to see the social workers, I'd say, so what would you have to offer? You know, and then they'll go over and they can explain. There's living will, there's a whole bunch. But as far as that pillar, it's you want to look at your social system, you know, and if you don't have a social system, you know, it's something that is recommended that you try and develop something. It could be a church group, it could be a community group. If you live in a facility of some kind, assisted living or something, that there may be a group there. It may be immediate family. And so whatever your social group is, and I generally, when I'm doing every 30 days for the American Association of Cardiovascular, it's AACPR, Pulmonary Rehab is our accrediting association. So every 30 days, we're doing assessments on each of our patients. And then we also have the discharge as well. So we're going through all these pillars and areas with them. And I question, you know, one of my questions would be is, Thanksgiving, you have Thanksgiving, do you have someplace to go for Thanksgiving? Or do you have a son, do you have a daughter, do you have a spouse, or someone somewhere to go and have some social support of some kind? And of course, especially if there's financial issues, you know, social work, there's a lot of areas that they can help you with. Dietitian as well, you know, in the program, we do recommend a lot of more plant-based type eating. And if you still the kind of the proven when they look at the top as far as the diet, vegetarian diet is still at the top of the list of Mediterranean, all these vegetarians up here. So whatever we can do in our diet to try and mimic that as much as possible, is what's recommended. So, you know, you're eating 3 steaks a week, and cut down to 2 steaks a week. But the physical activity, we kind of talked about that. 150 minutes is what's recommended. Generally, there are some patients that I see that are even higher than that. They're doing 270 a week by the time you get out. And then, of course, some of it's maintenance. It's the tough thing is if we're not used to exercise, we gotta get started somewhere. And it's not just in rehab. We need to also start at home, because that 12 weeks is going to go by, and then we're going to be left on our own in a sense. And so we need to try and get in a habit. And I don't know if anybody's ever heard of Stephen R. Covey. Stephen R. Covey, he did like the Franklin planners when they first came out. One of his things that he looked at is basically it takes about 23 days to make a habit. And so if you do something for 23 days consistently, then you should be. If you don't brush your teeth, you do it for 23 days consistently, then it should become a habit. Same thing with exercise. So we got to start somewhere. So even if we're not exercising at home, 5 minutes a day, 10 minutes a day, start off something small. I'm going to walk around the block. I'm going to walk around the block twice. Something that we can look at, we can keep consistent, that we can get into that habit. So that when pulmonary rehab is over, that we're in the exercise mode per se. And because otherwise what's going to happen is that 60 or 90 minutes a week of exercise, a session that we're doing in pulmonary rehab, whether we go 2 or 3 days a week, it's going to disappear. So we want to keep that going. Yes. So, and then we have kind of sleep, they talk about restorative sleep, so we basically 7 to 8 hours of restorative sleep a night is what's recommended. So if you have to get up and go pee, are you able to fall back asleep? If you have a CPAP and you sleep consistently with that, are you able to take that off and put it back on, or are you gonna be able to continue to sleep consistently? And so that's a whole nother lecture there. But there are things that we can, certain recommendations, mask fit and so forth. If we see issues, let's try and work on those so we can get that 7 to 8 hours of restorative sleep at night. Cool. And I think I got everything. Substances is that one. Just try and smoking and this may be hard for some, but vaping is smoking as well. It's included. And so I know that all my surveys that I have patients to fill out, but no, do you smoke? Do you vape? Because also alcohol, we want to try and limit our alcohol, because that cardiac health in general, it's good for us. So we should be having 8-10 alcoholic drinks a week. We can, what can we do to try and get that down? And it seems like a lot. It seems like you're taking a whole, you kind of rehab and all this stuff. Now, one thing about all this stuff is it's optional, and the stress, of course, is another, but it's optional. But the thing is you can come to rehab and you can just exercise. But we have so many we have 7 pillars that we can work on. And oxygen titration is a huge one as well. Because there's a lot of people that come in and they're on their concentrator, and maybe they're on a setting of 2. They come in and their sats are 83%. So there's some working on that we can do. Do you need more oxygen, or do you have too much oxygen? Maybe you're wearing 6 liters and you don't need 6 liters. So that's a whole nother subject as well. Something that we can work on in the unit during the class and so forth. And, one thing, option as well is to meet with your respiratory therapist, and we can go through your respiratory medications. Because if you're not taking your pulmonary, if you're not taking your Trilogy effectively, your Symbicort and so forth, and we're not getting down in your lungs, it's not going to work. And so we want to make sure that we have that where we can make sure you're on the right medication, that you're not taking the incorrect. Like sometimes people will be taking 2 long-term, long-acting bronchodilators and so forth. And so we can certainly look at that and make sure you're on the right medication, you're taking them properly. And we're getting out of time here. So any questions on the pillars, lifetime medicine?
So, and do you guys have oxygen here for them?
We do.
And how high does it go?
We have liquid oxygen here in the clinic, and it goes up to 15 liters. So anything 4 liters, higher than 4 liters, we're going to consider more high flow oxygen. But we in the clinic, we have these green, kind of these high flow cannulas that we use. Of course, if you're on high concentration of oxygen at home, we're going to recommend some humidification because you're going to get real dry. And so, because if you're in the hospital and we put you come in the ER and put you on 15 liters for a long period, we're going to have you on a Bakewell therm type device with some humidification. But in the clinic, if you're just requiring a little bit of extra oxygen during exercise, we'll just have you on. We don't need humidification because you're on here for an hour. But yeah, so liquid oxygen is what we use here in the clinic, and it's a nice because you can bring in your concentrate your liquid oxygen whenever you have. You can just get it switched over when you come in and use that oxygen in the facility. Good question.
So they will bring their own oxygen in and then use the clinic's oxygen before they exercise?
Yes. And if you really want to use your oxygen, you can certainly ask. I find most people like the liquid oxygen. It's a continuous flow, and to go on the liquid oxygen and stuff. So, because a lot of people will be on their pulse units and stuff, but you can certainly use it. Certainly ask if you like your individual personal oxygen. That's fine. But we do recommend the liquid because we have it there and it goes up pretty high. Questions? I did want to talk about just briefly about the scales. one thing, how do we make sure you're exercising? When I talked about moderate intensity and so we have skills that you'll get to learn when you're in the clinic. And I usually tell people the first day, I'm like, please come back. Because I mean, people come in here and I think they're overwhelmed. There's so much. If you're on the cardiac side, you got leads to put on and there's a whole bunch of stuff. And so, come in especially the first week or so, we're trialing, we're trying to see where you're at, how you're doing, and as far as exercise and stuff. And so it can be tough. If you come in the first day and like, I'm exhausted. Well, let us know so we can modify some things. But 2 scales on the pulmonary side. On the cardiac side, we just asked for the exertion. But the exertion really on here, we want to kind of have you more here about, between about the 2.5 to the 5 range on the exertion. You want to make sure you're getting something out of it. If you're reporting a 1 all the time, you're not going to, what am I getting out of the program, basically? But if you get way up here in the red zone, we want you to slow down. The difficulty breathing, that scale is a little different. So we're okay if you're a 0 on that one. You go 0 all the way up to 5 on that scale. It's okay if you're not short of breath. But if you're short of breath, we want to watch it. If you get up here around especially the 5-6 area, we want you to slow down. And so sometimes even have your inhaler. We'll teach you about spacers that we use with exercise. And so there's a lot of different factors, but these are some scales that you'll get to learn on the pulmonary side. And I got Jen here. Are there any questions? Kind of went a little scattered here all over everything, but
if you're on Trilogy currently, is there a time frame where you're using it and then can discontinue the use of Trilogy? Or is it forever?
the question is about Trilogy. If I don't know if the TV heard that, but basically, are you on it forever? Not necessarily. It's something that we're going to continue to check with your doctor and tell them how you're doing. The Trilogy has 3 agents in it, 3 long-acting, then an anticholinergic, and it also has a corticosteroid in there. But there may come a point that the doctor, you don't need the steroid, so they can take the steroid out. They can put you on maybe a Brule up there or something that has, they can modify it, so they can switch you. So you don't have to stay on Trilogy forever. Some people may be on Trilogy forever, and Trilogy is just a triple combination. We have a couple that we have, a Respiratory and a Trilogy inhaler. They're inhaler for breathing. So that's a good question. And the answer is yes and no, because you could be on it forever. You may not be on it forever. So it really depends on you and the progression of your disease, your pulmonary disease, and so forth.
So during rehab, is there testing to determine whether you need to continue with the Trilogy or go to a regular inhaler without the steroid?
So during the pulmonary rehab, this would be something that they probably want to repeat pulmonary function test with you. They may also be able to do that in the office. It's just an office visit. But we don't assess whether or not you need or don't need for the medications to go in the program.
So that would be my pulmonary specialist.
Yes.
Doctor.
Now, sometimes during the respiratory therapy consult, I may have a patient come in and they say, I have an alveolar inhaler I use 10 to 14 times a day. First thing I'm going to do is I'm going to check and make sure that they know how to use it properly with the spacer. And if they are using it, I'm probably going to recommend a long-acting bronchodilator. And so we can do some of that stuff during the consults. We can recommend.
Okay.
But as far as like completely taking it that has PFT, we got PFT results is usually what the pulmonologists look at on a lot of those medications. So they look at one of your FEV1 on there. So yes, good question though. Did I answer it?
Yes.
So yes and no, but it was really your pulmonologist or your primary that made the decision on this.
Okay, good. Thank you.
Yes.
So if the person's on a full-time oxygen,
Yes.
then will they be qualified for the
Yeah.
program?
So the qualifications are different. Oxygen itself would not be a qualification for that. We go by the disease processes and so forth. Pulmonary fibrosis, alpha-1 antitrypsin deficiency. But that would be something that certainly you talk with your physician about that, because I say that, but maybe with your oxygen, there's something that fits into that parameter that would qualify you for pulmonary rehab. So certainly, oxygen alone though wouldn't, but in conjunction with something else that you probably have to do. Generally, if you're on a bunch of oxygen, there's something else going on.
And so is there a baseline or an oxygen level?
Not as far as getting into the program.
Okay.
That way they go off of the qualified disease status. Yeah. Same thing on the cardiopulmonary. Sometimes it's surgery. Sometimes you can have a recent COPD exacerbation. I'm into the ER for COPD exacerbation. I end up having to stay in the hospital for 4 days. That could be a qualifying diagnosis to get that. So whether you're on 2 liters or 6 liters.
I really encourage you guys to really look into taking this class. I'm currently in it, and the age group is huge, from our age on down and on up. And they keep taking your blood pressure and checking your saturation as you're exercising continually.
Yeah.
So they're always monitoring you, and it's a wonderful class. I would not hesitate at all about moving forward with it.
Thank you. Appreciate that. And as I tell my patients in my class, don't look at the person next to you. This is an individual program. It's an individual. You're going to have your own individual assessments. And so as you go through the program, and you're going to, you come every day. You come on. I say every day. You can miss some, but come on a regular basis. Come consistently, exercise, and if you follow the guidelines and so forth, you're going to find success in the program. And you're going to look for 12 weeks. I'm going to look at here, I'm going to look at here. You can see how far you come. And then the graduation day is the best. We come on graduation day, and it's a sad day because we've been working together for 12 weeks, so we're going to miss each other. And sometimes the case manager will get a little teary-eyed because we go there. It's great. It's a great experience watching everyone progress week to week. But then we have a printout for you that's going to show your progression during the program, how much you've improved, and it's a great day. You get a certificate and T-shirt, and so it's happy time. And then some people, like I said, we'll come back. But the kind of idea Jen's going to take over here. She's one of our nurses, and she's going to kind of talk about things we can do after the program. Even though sometimes we may come back. But what can we do in the meantime to keep up what we're doing?
Yeah, it's up to you guys after that, right? Hi, my name is Jen. I'm one of the nurses here at Lifestyle Medicine. I work in pulmonary rehab also, so I get a chance to see all you guys and see how everything's going. So what Dave wants me to talk about is our sister program is Lifestyle Medicine over at the YMCA here in South Meridian. It's off of South Eagle Road in Amity is the YMCA location, and this clinic is located right inside of it. They're their own clinic, so they're not necessarily associated with the YMCA, but they are a clinic that's basically an extension of us. So what they do is they do a lot of intensive health coaching. They do health coaching. They do dietitian training, cooking classes. The social workers are over there to kind of meet with people and work on stress and insomnia, working on substance abuse and issues like that. Here you go. Sorry. So basically what this is would you like? Oh, okay. All right, and I have a few more up here if you guys want. Oh, you had some already. I came prepared for no reason. Anyway, so that lifestyle medicine program at the Y is something that is a little bit different because you do still need a referral for it, but you don't need to have the same kind of qualifying level that you need to come here. most of the time when you're coming here, we're thinking of this as more intensive rehab, right? We're like, okay, we've had some sort of event. You've had a COPD exacerbation, you've had, something going on, you're getting back with your full pulmonary fibrosis, whatever's going on. And so you need to have kind of intensive rehab where we're a monitored, supervised exercise program. This program is can be done without necessarily all of that. You do need, I believe you need a doctor's referral because they said it here at the bottom, just have your referring provider call that number. But it is really for anybody. I wish everyone in America could go to it. What they do is they meet with you. Dr. Shawls, who's our medical director, is also the medical director there, of course, and she's there 3 days a week. And she is running what's called shared medical appointments. So they're doing kind of like the medical appointments they had here, which are in a group setting. They do that over there as well, but because you get to be there for 6 months, you get a chance to really delve into what you've learned here and take it a step further and kind of own it on your own. You get to do, I'm going to put this in front of my face before I try to say it. You get to do 3 classes with the registered dietitian. You get to have 2 appointments with the exercise physiologist. One of them is an exercise evaluation, and then another one to kind of get your exercise prescription set up. Now, it's not the same as the exercise prescription here. Here, we are very, every day we're looking at it. Is this where you need to be? Do we need to increase? Do we need to decrease? We're watching everything you do, monitoring everything you're doing every second. We're doing that here. But on this is a little bit more of taking it on your own. They give you an idea. Here's your exercise prescription. It's up to you to do it. Right? They have some open gym time. They have a whole gym area there that is just for lifestyle medicine. It has a lot of recumbent bikes, new steps, treadmills, elliptical machines, weight machines, things like that. It's not super huge, but it is their little area that even though it's inside the Y, it's not part of the Y. And only patients of the program can be using that area. There's always an exercise physiologist there in case you have questions, but they're not monitoring you. Okay, they do not have oxygen there, so you would have to use your own oxygen. That's the one drawback. But you do get a chance to kind of, get real deep into learning everything. You get to get real deep with the registered dietitian. You get to meet with that exercise physiologist. And then one thing that they have there that we don't have here right now is nurse health coaches. Okay, you have nurse health coaches. So you get, 6 sessions? Let me make sure I'm reading it correctly. 6 sessions with a nurse health coach. They're certified health coaches. They sit down with you and talk about digging deep. We talk about what is your wellness vision, right? Where do you see yourself in 10 years? What can we do to get there? How confident do you feel doing this mission of yours, right? What are you trying to work towards? What can we do to get you more confident in what you're trying to do? So that's what I feel is really super important. Health coaching is very important, especially from that nurse standpoint, where they really get to delve into that with you a little bit. Some of them aren't nurses, I should take that back. They're certified health coaches. Anyway, but they do that. They also do, the social workers work with behavior change, so creating healthy habits, maintaining behavior change, establishing healthy relationships, healthy healthy sleep. I don't know what to do with your speech. Stress reducing strategies, all that kind of stuff. They've got a lot of things. They also have a whole app that you can join called the Carium app that kind of you can enter some information into as far as what things you've been doing, and they can kind of help encourage you. They've got a whole Facebook group that is all about how is the diet going? What can we do? Share recipes, all that kind of stuff. So it's a really great way to have a good support system. And what I love about this is that it is only $249 for the entire thing. 6 months, right? It's a long time. It's a long time. You get all of that stuff that's on this paper for that one-time fee. They're working towards revamping it here in the next few months just a little bit to where they can get a little bit of more insurance to try to help with that, because I know that's still a chunk. They also offer payment plans too. You don't necessarily pay the whole thing all at once. So talk to them, give them a call, see what kind of things you need, see if your doctor doesn't mind writing you a referral for it. But this kind of thing is just amazing. I love the supplemental classes they have there on the back. You can opt into those. I don't exactly know how it all works. I don't believe it's an extra cost, but just double check because I don't want to steer you the wrong way. But that program is awesome because you really get a chance to get, like I said, get real deep with them and really take what you've learned. If you've done this rehab program before, then you can take this and really move on with it and get deeper with it on your own. Kind of think of it as like a stepping stone. Maybe you're not ready to go to the gym all by yourself, but you've done a rehab and you don't want to lose the improvements that you've made. Well, then maybe this would be a good stepping stone because it can kind of still help coach you through it.
Cover all ages.
Yeah, absolutely. Yep. We have people, we even have minors occasionally, but usually it's 18 plus, 18 to 199, whatever you want to be. Yeah, and they've got a lot of different, like, the machines that they have are very different as well. So, and the beauty of it being in the YMCA is that now you can join the YMCA as well. The YMCA, just so that you guys know, does not ever refuse anyone for inability to pay. So if you ever have any concerns with financial things, talk to them. Medicare also covers gym memberships a lot. I even know some people who have 2 and 3 gym memberships that Medicare is paying for. And then the YMCA is huge on active older adults is what they call it. I think they just changed it to Forever Well is now the new program, but it's just the same thing. Active older adults, we have everything from chair yoga to water classes to, moving up from there. There is so many things available at that YMCA, at any YMCA, but this one, especially since it's right here with this program, might be a good way to just think this is a first stepping stone, then move on to the YMCA, kind of doing things on your own. Anything you can do to own your own health is going to be actually lifestyle, not just for 12 weeks. Anyone can do what we're telling you to do for 12 weeks, right? I mean, that's how that works. So got to kind of figure out how to do it on your own. That answer the questions?
Yeah. Can you talk about the field over here too?
At Touchmark?
Yeah.
Yes, absolutely. So there is a lot of community resources out here, way more than I even knew. And I've lived here for forever and I work in this industry. I'm actually a fitness instructor and I do this. And I didn't know about all the community resources that we have around here. Touchmark Assisted Living, which I point this way because it's there. That's where it is. It's out in that field. But Touchmark Assisted Living has their own gym and even has their own pool. And that is open to the community, which blew my mind. I didn't know that. It's open to anyone that is, I believe, 55 or older. You can get a membership to their gym. And they have physical therapists there that can do evaluations and work with you for physical therapy reasons. They have the pool classes. They have all of the equipment that they've got. And you don't have to, go there, you don't have to live there to go to their gym. So that might be something to really check out. We have the information, I guess I didn't bring that with me, sorry, you don't have it. It's out by the elevator though. There's a lot of information, says community resources, tons of flyers out there. There's the Meridian Senior Center. I actually just went there this morning really quick to grab one of their next flyers because they've got so many events going on at the Meridian Senior Center. They do lunch every day with Meals on Wheels. Everybody gets to come and do lunch together. They have people come out and do financial assistance, and every once in a while a lawyer will come out and talk about wills and things like that. But then they do all the fun stuff too. They have bingo and bubbly right now. Bingo and bubbly. That sounds kind of fun to me. I kind of want to go. But they've got, Zumba classes. They've got, all kinds of, they've got a lot of fitness classes, but they also have a lot of just community things. People getting together, to do all of that. I should have brought that with me. I could have explained some of them. But anyway, there's some flyers out there with that. And that, that has a little bit of a cost as well. Everything's got to have a cost. But it is amazing what kind of resources our community has. So check out anything you've got out there. You can always ask us questions about any of those things that are out there. We'd love to answer those. But anything we can be doing to own our own health is the biggest key right now. Because, like I said, anybody can do what somebody's telling you to your face. You've got to do it on your own for it to be a lifestyle change, right? So, yeah. Anything else? Any questions about that, actually?
Is that called Touchmark what?
Touchmark Assisted Living, but they have a gym in the assisted living that's open to the public. Mm-hmm. Yeah.
I just wanted to make a comment. I'm a graduate about 2 weeks ago of the pulmonary unit and the rehab, and I can testify that it's fantastic. The people there care, they care. The difference that it's made for me is amazing. It really is. I thought I was gonna have to go on oxygen to exercise. And because I've been exercising, I've been trying to keep up and do my stuff, but I thought I was gonna have to go on oxygen, and I don't. I can just keep going and doing what I'm doing. And, they help me find out where my good stopping point is. For me, exercising, that was a really important thing, because I would exercise and I'd get like, I'm gonna exercise, and I could probably go a little bit too far and of course become too breathless. And been doing it there, very synchronized. This is what we're doing. This is where we are. I found out the right places for my body to be. And that has made all the difference for me. I can just keep going and going. I lost weight. I increased my metabolic rate. And I met some great people that I've now become friends with on Facebook. We're like, how are you doing? Checking up with each other after the fact. So I can't say enough about it. It's fantastic.
That's awesome. I'm so glad to hear. That's kind of what we want, right? We want to build a community a little bit. We can't tell you to do that, HIPAA, but you guys can do it all you want. Any other questions? Okay.
All right, well, thank you. Yeah, we were just gonna finish up. I do have some stuff over here I'll talk about that I brought as well, but, like was said, oxygen, I've seen some people, especially with the COVID and the post-COVID syndrome and stuff, come in on 3 layers of oxygen and leave with no oxygen. So it really just depends, and just because you don't leave with oxygen, that doesn't mean it's a bad thing. But the key to it is that lung exercise, lung expansion, getting that daily. And, we have aerobic devices. We have other stuff we can talk about as, once we're in the program. But, we really do, the staff really, we love what we do. We're here because we enjoy it. And a lot of us have worked in the hospital for years and years, and this is where we want to be. So, but I do have some bookmarks over there. I have some stickers. I also have some stretching routine, stretches, dumbbells, TheraBand exercises, and stuff over there. So please help yourself to that. And then of course, any other questions, bring them to class, or we can answer them. So, thank you.
I don't know yet if that was gonna work, but I mean, it was
Yes,
a try.
he just got graduated.
What do you feel?
Occupational therapy.
What do you